Lukumi. Mulabe.
I'm here to do some like 27.
Talk, or how much are you going to send to contribute?
I'll definitely send. Can you listen
how
to
much?
Mu ajja kusendinga wamma tunnyonnyole.
Ati agenda tuzza mu birala senge
Erika!
Anange, Mama, don't put a video. I'm not decent.
That's okay.
Ng'olina ssiro nnyo beera mwangu ng'omuntu alula kulwadde.
Abagala okusindika PayPal. PayPal is the name Sharon with 2 N's 89@hotmail.com.
My name is Carol, and I am a mother of twins. And in 2018, I gave birth to the twins, and we did not know about sickle cell. So when I was 6 months, never tandiko kulaga sickle cell. They started swelling and all that. And what is amazing about sickle cell is that it does not manifest until omwana watandiko kuswelinga.
Did you say what's amazing?
Yes, I said that.
Amazing about sickle cell?
Well, it's in it that the disease itself manifests in an amazing way. It swells. It does not come like any other diseases. If you understand my explanation, it was colloquial. I lost my trail of thought. So anyway, the twins got sickle cell. I had never checked for sickle cell as a parent, but my husband's side has a few people with sickle cell. So nze nakaya na nengamba tetulina sickle cell. Now, just to go back, sickle cell is brought by a mother and father. Both of them should have the sickling gene.
It's in the family.
Yes, the sickling gene must be able will produce an S and an S. I wish there was a
I know it. The money.
Yeah. So what happened is finally, anyway, we contact a hospital in India called Medanta. Are we allowed to speak names here? Names of hospitals and stuff? Okay.
I think better not for some people's safety and privacy.
Skyra, please. A hospital that's public owned business over information. You can mention them.
No, I'm talking about hospitals. No,
you can give one name.
About hospitals, man.
Banange waliwo omuntu ansindikidde 2,000. Banna Uganda 10,000. Oba 2 oba 3 oba 5 bambi send. We are 1K people. If we all get
tugenda sonda 2 ziwere mmeka.
Please. Banange ne banabeera waliwo nsindikidde omutwalo gumu mu 10,000. Thank you, Habat. Thank you so much. 10,000, 2, paka. Let's go. Thank you so much. Yes,
Kaira, send.
And those matter because Jayden has got to go for what they call an HLA test. The HLA test is what is going to determine who his donor is. Katitemula brother when a donor. Donor.
Hold on, Konke. I thought before you say you call someone a donor, make sure you move compatible, isn't it?
No, okay, so for now, according to his narrative, they're going to Kuba Kebera.
His brother is willing to be his donor if he matches.
Yes.
Banange so opposing banange badona tuchabetaga muveyo emwebedde ba complaininga muveyo yes kanfune pendol pa plus acid. Anyone who is willing to be a donor ngenda kuandika erinnya lyo since you guys want to save Jayden's life. He might need brother ayinza obutabera compatible So twetagayo abantu stand up as next
Thank you, Sophie. Waliwo ansindikidde 15,000. Thank you so much. Thank you so much. Sanyu naye ansindikidde omutwalo gumu mu 10,000. Thank you so much. Very much.
So Sebo, you cannot be a donor unless you are part of his family or his lineage. Twins akuvawa eri nobera donor. The only way you can be a donor.
Omulala ansindikidde 10,000. Thank you so much. Enamba eri 0 spanand. Mulindeko wano.
Zeno live ya lero simanyi oba naamalako. Senga bagambye dono olina kubeera wa family ye kati kwegamba.
Obanga abadona abali ebweru babateekamu nga olaba spam donors
like IVF bagambe IVF
like IVF, yes.
Yeah.
But the difference between IVF and the bone marrow transplant donor, there are certain markers that they're looking for that will make your bone marrow grow. Anyway, so for us, when I'm called Conte.
Obusomyo bwe bayita bone marrows.
Obusomyo obukuza omusaayi gwe tukozesa.
Ng'amasavusavu agabeera mu mugumba.
Bwebo babuyita
busomyo. Ngaga nange entege tulya bone marrow y'ente n'ogigira.
Yes.
Oba tobulina, it means you can't produce blood.
Yes.
So, and then for correction,
mulindeko bannange tuli mu kuyiga obusomyo obwo bwe buyambako producing omusaayi mubiri.
Ye mukama wange kubanga omuntu wa sickle cell abeera alwala endwadde eri obusomyo. Kati obusomyo obwo
Kairo tandise tubuzaabuza nno.
Tebulya obusomyo obu. Okay, can you allow me to call it bone marrow because I'll get confused. Okay, bone marrow aka obusomyo a producing that white and red cells.
Keep going. Thank you guys. Nzifunye.
But we're producing omwana alina sickle cell is a producing a cell ngeli sickled. Obwengamba sickled producing a C in the shape a cell ngeli C. So which is what they call the sickle. They call it the sickled cell. That is why it's called a sickled cell.
Our cells are like this.
Round.
Yes. Sickle era weight. Like eva weight. Yes, weight yo.
Cells ziringa ezigundi obutonde bw'omubiri kati kitegeeza Katonda abeera akuyita banna.
Katonda takuyita ng'olina sickle cell bw'ati.
I've received MP5. Thank you. I've received MP5.
I need to tell you something. I'm a sickle cell carrier, and mu bulamu bwange sifuna malaria. The only thing echinuma is chifuba ne senyiga. We are very, very strong people.
By the way, abantu ba sickle cells, by the way, they never suffer from malaria. It's
so we are two types of sickle cell people who carry
the
so
gene.
The first gene
a normal red blood cell is like this. A sickle cell is like this.
Goda.
Yeah.
Okay.
Kati, we are two types of gene carriers.
Yes.
Konke olina sickle cells oba oli carrier just nga ziri inactive.
I'm just a carrier. I'm a carrier.
Nenga tozina like teziri active ukuluma.
No, kujako wenegata no mami wange then netufuna abana balina sickle cell.
Awe 15 nzifunye.
Abana bo
Mother
Kati
of
bali
the
mu
girls.
mbeera ki? Like let's speak about
Balamu
your kids.
balinga gwe nange.
Bawona.
Bawona. They are 7 years post bone marrow transplant.
Babakola gundi
Babakola
ni
bone
CRISPR.
marrow transplant. Bakola
emitwalo 10 emirala. Thank you so much.
Kakati omanyi CRISPR. You know about CRISPR gundi je balese method another way to heal wounds.
Yes, I have.
Okay.
I've had it.
And you live in the US, right?
No, I live in Uganda.
Ni malo bagikolera Uganda.
No, bagikolera India.
Abagala cash up number. Abagala cash up na Linda Kohamu. Abagala cash up. Look for this name. Queenie Mbabazi.
But we win number senga.
I don't want to give them her number. Queenie Mbabazi, that is the cash out.
Kuliko kifaananyi kisenga ku gundi ye ku account ye. Kubanga nakyo kiba Queenie Mbabazi bayinza okubanga bangi ne basindikira omuntu omulala.
Nkinonye bannange, I have received more money. Wait. I have received
batestinga wansi w'olulimi ne bajayo amalusu ne bagatestinga.
I've received 159,000 then n'omutwalo gumu musindike okuvira ddala ku
Ani akubira
10 eze Uganda. The more the better. We can do this. If you don't have at least send olukumi. Tujaddu mutuusaako. Everything matters. Every coin matters. Genda. Abagamba nti wandiika sente, don't worry. I know how much money nenda zibalaga. Tugende maaso.
So bwe twamala bone marrow bwe twakolera ezaffe Uganda bali tebazikola, so we had to travel to do them. Ate ffe twali bangi because jjukira balongo. My son, I have 4 children.
How
my eldest
12 waliwo omulala asindise 13. Sorry, I'm gonna keep interrupting you. I have also received emitwalo 2 n'ekitundu. Thank you guys. Thank you. Genda mass.
It's all right. So we had to test all of us. First of all, it's also one of those things that you do. It establishes if the children are for your husband, but which is a funny joke. But after that, we discovered that I'm more compatible to Babidie, and my son, my eldest son, was more compatible to Nakato. Their father was there, but it wasn't as good. And then my other son wouldn't do because he has autism. So we were not able to use my son because of his autism issue. And then we started, we went for HLA, the tests came out. It took quite some time. Then we decided to go. Now here is the problem. Abana bali no mwaka gumu, bali bagenda kuweza mwaka gumu.
I've received the 12,000. Thank you from Haula. So
Abana bali bawezeza bali balina okuweza omwaka ogumu to go. The doctor offered me 2 options. Either abana baweza omwaka gumu oba baweza kilo 10 okugenda mu ddwaliro okukola ki, the bone marrow. Now abana ba sickle cell bwembanga mubamanyi, they don't normally gain weight. Banange nabaliisa everything that you could think of on this earth. I counsel women and children and parents who have children with sickle cell here in my living room. Anybody who feels like they want to talk about it, what do they feed on? How do you keep them healthy? Bali echi banywechi, tolya nanansi, tonywa bichi, amazi ye best friend wo, because anything acidic triggers a crisis.
And
There's
you have
so
to
much.
take a lot of water for the
Yes.
for the cells like
For the
to keep
sickle,
moving.
yes. But then the other trick we discovered along the way, before I tell you about the bone marrow transplant, is amayuni. Now, I don't know if you know, but 76% of West Africans have sickle cell. Abo ogabona bolaba abali awe, bonna balina sickle cell. But
I have
what
received
saves them?
emitwalo mukaaga then ne emitwalo mukaaga 2,200 n'olukumi genda mass.
What saves the people in West Africa, the Nigerians, is that they eat fufu every day. Agamayuni. It helps to expand the veins in their bodies. And as it expands their veins in their bodies, omusaayi guyitawo. Naye abagayi bonna bemulaba abasinga balina sickle cell. If you notice that the deaths ze tutategeera mu social media, ogenda okulaba bakugamba bagundi yafudde and is been a celebrity temutegeera lwaki. If you dig deeper, it's either thalassemia, which is equivalent of sickle cell. So amayuni, they've also developed as abatanatuusa kugenda kukola bone marrow, waliwo eddagala baliyita diascovite. Dirungi liyambako okuexpandinga veins ezitambuza omusaayi, so you will not get affected with the sickling.
Wait, I've received emitwalo ebiri, I've received gumu bbiri, I've received omutwalo gumu, then I have received 10,000. Keep sending, guys. So ka nyinyonyolemu oluzungu lungi nnyo. Mukyalo ono agambye aba West Africa abasinga, aba Nigeria, aba Ghana balina nnyo ekirwadde kya sickle cell, like abantu abava. By the way, also, can you tell people that it is also by race inti abazungu batono nnyo.
Yes.
But abayindi n'abaddugavu tulwala nnyo ki?
Sickle cell. And then aba Somali n'aba Chotara, Eritrean and Somalis, Ethiopians get what they call thalassemia. So it's called thalassemia, and it's equivalent, the symptoms as equivalent to sickle cell.
Then nekirala n'agamba inti aba Nigeria bamanaginga sickle cell because balya nnyo fufu oba like pounded yam, kati amayuni ago gayamba okugaziya emisuwa. Bwe gagaziya emisuwa, the blood kale ebeera like I don't know, blood flow.
Yeah, the blood flow is a lot better because the vein increases in size.
Like vein dilation, right? Like
yes, that's
so omusaayi guba gutambulako bulungi. Then ayina ne medication endala gy'ayogedde agibaddiremu awo eyambako also abantu abalina ki
sickle cell. So eddagala baliyita diascovite. Diascovite oliwa abaana liyambako, it comes out of Nigeria, be balikola liyambako ku expanding veins.
Because I think dia for dilation and vasco for veins, right?
Yeah, I guess so. Yeah. So it's called diascovite, and it was very effective. Nzesawa abaana this other one erinamu chemo nabawa diascovite paka
musindika sente.
So munange bwe twamala tumaze I failed to get the kilos. totally. But the children were healthy. We had tried to deny poly, everything that makes them healthy. And then we decided, well, never was 1 year, and we boarded to go to India. Now, when we reached India, actually my babies, a hospital, Bajita Medanta Hospital, my babies were are the first babies of that size to have a bone marrow transplant. Baali tebakikiriza nti basobola okukola bone marrow transplant ku baana ab'omwaka ogumu abasize kubanga balina 8 kilos. They were so tiny. It's a very lethal
abana ba 8 years abana ba 8 years
balina
8 kilos
kgs, yes.
abana
at 8 years
emeka
no, they were 1 year at 8 kgs
only.
Yes. And the doctors in India were like, kale tukatukoleko omunemba gamba nalesa abaana babiri. I want both of them okubakolako ate bombi ngenda babeera nabo. Now, bone marrow patients, aina Bambi Jayden kyeyayogedde, and I think it's because he's not yet informed about the process. He said, well, tugenda tusule awantu oba muloji. The moment Jayden becomes
it takes
a patient,
so long. You spend weeks and weeks.
he cannot be in the same area with other people. Fe twaliambala masks before the entire country wore masks because we did ours in 2018, because abana nga balina okuba nga bali sterilized. Yes, everything attended.
How much did it cost you guys?
So well, let me explain it this way. Mine might have been very, very expensive. One, because of the twins, and tiabali balongo bali babiri, and then two, by the time when again derayo, not very many Ugandans were going there. So when akugambe sente,
how much did it cost
you? Let me land. So what we did is we negotiated an amount in India that they are charging today, and that's why they charge between $30,000 to 40,000.
Okay.
To 45, yeah. Dulizali nyingi. Now, if I say it here, usually nebwenzogera mu interviews, abantu batandika mwe mwali na sente, you know.
No,
the message
then
I want to drive.
We just want to do the math.
But wait, if you are working, was that per child?
Yes, that's
People are saying how much was it?
So, but for me, it was even higher for per child. So our total
madam.
Okay, our total was $234 US.
Mitwalo kumi plus. Mitwalo kumi
$234,000 US in total.
Mama.
Kati ate waliwo mulina okufuna apartment. Ate apartment eyo neba ngerimu ebisenge.
Does that come with aftercare?
No, you do it yourself. If you say aftercare, that it's you take care of it. The hospital doesn't take care of it. So you spend 100 days in hospital. You spend 3 weeks in hospital. Then they ask you. Yes, my dear. Yes.
Okusinzira ku byetuwulidde bannange musindike sente. Let us pause for 10 minutes. Bannange mulindeeko. Let us pause for 10 minutes. Uganda, Jayden is gonna need as much money as Ugandans can contribute for him.
Okusinzira
ku kyetuwulidde bannange musindike sente. 123 enamba. It is 0756 433 850 Nagaba patients. 0756-433-850 n'agaba patience. Ekisooka abantu abaagala omwana ono abamu explaining the harm bayinza okubeera nga bamugambye the hospital naye nze mmanyi mbuno omuntu wa bone marrow transplant ne bwatabeera wa bone marrow sikosero harm ne kasenyiga ne obulwadde bwe batalwala wano naye bacteria virus their immunity is compromised so ayina okubeera mu kifo
kati the process
for aftercare
okusinziira ku byempulidde senga sidi byannyonnyodde ne konche byayogedde tuleke Jayden yafe
wakalya omuliro okusinziira ku bye batugambye okusinziira ku bye batugambye abannayuganda let us pause musindikire omwana sente 0756 433 850 the names n'agaba patience bannanga omwana yeetaaga sente 0756 433 850 musindikire omwana sente 10 2 3 4 omutwalo akakadde bannange mutusondere ku sente this a youthful life ahead
talina future yonna talina youthful life
alina
tekigenda kusoboka
musindikire omwana sente abagagga bawano tubakoowoola well wishers abantu ab'ekisa mikwano gy'abangi musindikire omwana sente 0756 433 850 amanya n'agaba patience
senga okusinziira ku byempulidde ku konti atuweeyo omutwalo kubanga emitwalo 23 ejja $, obeera oyimiridde
waliwo atusindikidde omutwalo bannange thank you waliwo atusindikidde ebiri
ejje Uganda
osindika binnyo kale bannange a moment okusonda sente ow'olukumi 2 3 abadde agenda okugula malaya weefirize tebakugyamu olwaleero omwana
weekubemu akasabbuuni naye senga kino ntogera
ow'ebizigo togula bizigo contributingira omwana Walaji agula enkwacyo bannange contributingire omwana 0756 waliwo Bridget 10,000 has been received waliwo omulala atsindikidde 3,000 it has been received bannange abagagga abagenda mu mabaala gwe kimusiya n'ogwo ogutwe yitawo otusondere waliwo atuwadde emitwalo 10 tweyanziza nnyo it has been received waliwo atuwadde emitwalo 2 it has been received waliwo has been received yes
muzisonda nafa wanji
cash app sirika hamu don't interrupt me abagala cash app waliwo omulala atusindikidde omutwalo it has been received abagala cash app look for the names Mbabazi Queen QWIN Mbabazi waliwo atusindikidde omutwalo 10,000 it is received a number eri kuyita waawo with the names n'agaba patience musindike
na Uganda
waliwo atusindikidde 15,000 Gertrude it has been received God bless you yes Gertrude waliwo Gertrude atusindikidde 15,000 God bless you guys send as little as you can yes bw'osindika nesitasoma linnya lyo it does not mean the money has not been it might take longer but as soon as it comes nenda balaga how much money we have contributed and You know, so guys, Bambi said, this is not a laughing matter. We have to save Jayden. Abadenga wano, abakolera buskitsi ne musinika ebinyo ne mumuvuma. Ogira amayuga bulwadde Bambi. Waliwo atusindikidde.
Betusonda n'atawona. Eza sanduuke kusima ntana seminti I will contribute naye bino bino
nusu lukumi mu lukaaga the money has been received waliwo atusindikidde emitwalo 5 it has been received tugendere bannange nga bwe mutapinga live tusondere omwana sente you want to send 1 million tewali akuganye please send it waliwo atusindikidde emitwalo 12 120 it has been received waliwo atusindikidde olukumi it has been received tap guys and send money tapping bannange tusinika nnyo wane ebinyoleka naffe tukoleko ekyomugaso yes if the whole of Uganda tusondere omwana sente tusondere omwana
betusonda nafa kyembuuza betusonda nafa
Katonda
mukudda
money is being collected is guarding against him dying.
43385 ham when we are collecting money please don't be negative because oberanga asera contributions z'abantu ham if you cannot say anything nice at least shut the hell up. Yes, 0756.
Fewa opposing mind naffe gye tuli temutwerabira.
Right. So let's use this part. Okay.
One mama should we contribute?
Waliwo atusindikidde omutwalo. By the way, guys, as we speak, we should be in almost 1 million.
Mommy.
Guys, as we speak, we should be in almost 1 million.
Ku mitwalo ena kitundu tulinako $3.
Agamba.
Uganda, you play too much.
I don't think it. Omuntu ali okuwandika ebibozi bya reverse onenda commuting. You're giving people ideas. Tosinika wa binyo. I don't think any person asonded Jayden.
Wanji nange muleke Jayden agende mirembe omusondereza birala
olukumi and I have also received omutwalo gumu mu 12,000. Guys send.
Kadama kwata ku musaala omwezi gwaweddeko Kadama
075643338. Guys send money.
Kadama mwaba wa 50 the queen sente musindike
waliwo atusindikidde omutwalo it has been received thank you ayagala embozi ya konye genda ogisabe nnyoko you're very selfish oberanga agamba that is the reason why you actually leka nkubulooking olinga amazi konye konye wamusasudde okujja wano tubulira emboozi waliwo atusindikidde emitwalo 3,200. Thank you so much. It has been received. Yes, it has been received. Thank you. Thank you. So Uganda with using people. Tasindise wadde omunyo agamba. Kanye your story saying aleti konye speak genda obigambe nnyoko. Senga, I have sent 500 shillings. Sinabazifuna. 07564333850. Guys, we can do it. We can do it. Tigenda kuleta pressure because era nawe natera okusuula.
Ange nkoze eki.
Waliwo atusindikidde 5,000 nalwanga 10 minutes we shall
Senga the laws of physics bagamba every force ebira ne opposite force
in the next 10 minutes tugenda ku resuming embozi ya Konyi. 0756433850. Guys, send. Lukumi, biri, ate buli wena nkola live tugenda kujja wano era gwali eyo. Esente za Jayden zijje muzizo. Buli lunaku
zijje muza holiday
12 oba 5 oba omutwalo buli lunaku.
Zawule muza holiday.
Agambye ziweze ka
mbawola kubasama. Bagenda kwera mu mabala nga baspending million ne million. Bagambe baweyo basavingeko just million emu.
Pepalo.
Tuzike Jayden.
Wabewo awandika Pepalo ono mu comment. The name Sharon with 2 N's. SHARONN 89@hotmail.com. Sharon SHARONN
Real comment
@hotmail.com. Actually ka njibalage wano.
Real comment agwatero ziwandika mu bwangu jiwandike naye senga. Every force eberako ne opposite force. That's the laws of nature.
We are not banange Shari yes bajire sawa muchi mu comment section PayPal yiyo cash up. Let me give you that.
Jayden njala mtu alako out aliye anywe Jayden manye nti banange byali omulamu. I did this, I contributed something na anyumirwa obulamu. Ne bino bye muli mu simanyi mutwala India tekijja kusoboka. Kati musonda sente nafa. Muba mde mulwanyisa Katonda.
Toina kyotugamba. Cash up. Wali watusindikidde emitwalo 5. It has been received. The cash up is here. Abanoonya cash up. It's Queen Mbabazi. Take a
screenshot.
And it has pink toes. Wali watusindikidde emitwalo 4. It has been received. That is the cash up. That is the cash up over there.
Jayden taligamba nti twamulaga mukwano tukulaze nga akyali mulamu.
PayPal erimu comment ne namba yesimu. Yes. Okay, tugende mu maaso. Kakati abagamba senga tusaba Zaina Nachozi atusondere gwe owaddeyo mmeka.
Jali ya mizi ya waddeyo mmeka.
Nkoye gwe owaddeyo mmeka. Bambi musome Zura ataddeko my PayPal yiyo sharon89@hotmail.com. Enamba eyesimu nayo yiyo eyitawo mu comments. Tugende maaso. Onye
Puruta abadde kibannange. Puruta akungubagira mulwadde sorry.
Puro kam.
Puruta akungubagira mulwadde.
Pluto abagamba senga toyina wallet, stop asking me for impossible things. I have given you all possible things. Abasindika PayPal, that is the number. Abasindika e-transfer abe Canada, the same email is the same email eya PayPal.
Ne Pluto awaddeyo contribution ye in that form.
Okay, so that said,
nze ne Pluto tuli tuti.
Konche genda mass.
So sorry, it will take me a while to recollect my thoughts when coming, but
tugamba how much you spent in total.
Yes. Ate nechira konche bawo kyali nayo bamwayawukana munonyeko.
Ndinaye.
Musajja okirizibwa omugabana.
Tekisoboka.
Sengo yo musajja tulina omugabana ne konche era ngenda kujjako mu kabox ko.
Wanalo.
Kusaba kubeera mujjawo.
Genda mass.
Tofayo tujja kuba bulungi. Kakati.
Bigger one.
Kati, when we arrived, the doctors had refused. But I want to relate what I'm saying to what Jayden is going to go through. Jayden Wanatuke India, the one thing they first do is to reduce the amount of sickled blood. Orokuba Kati, my children, first of all, one of my children, Bobby had okay, babiri. She had 78% sickle blood. Nga meaning ti normal blood yali alinamu 22. Naye ate because she was 1 year, it meant she also had fetal blood. Kati fetal blood eyinza okubeera about 12. Nekitegeeza nti her normal blood eri just 10%.
What?
So literally abatayina musaayi ogwo. Kati jjukira nti omusaayi gwaffe gwe gufaako oxygen, yeah?
Yes.
So sometimes the sickle cell children die actually because of lack of oxygen.
Yeah.
Yes.
The other thing that happens is once they start bleeding, they lose blood, like quite a lot.
So
Anyway,
they don't have platelets or adequate platelets.
Yes.
The clotting factor.
yes, it's very minimal.
Yeah.
So what happened was they got Zaja and Zion ne baba reducing omusaayi gwabwe gwa sickle cell. Ne gu reducing, then ne babawa omusaayi omulamu. So that babeeranga bali normal children. So they reduced it almost to 5%, then ne babawa. Yes, then ne babawa. But you see, because we're twagendera ntuza baali bakyabikola nga biri so manual nga omwana bamusikamu omusaayi there and then ne bapima ne basikamu ne bapima then bwe gutuuka then ne bamuwa packed cells ez'omusaayi. So anyway, that is the first thing they do the first night. Then of course the other thing I skipped were the tests. Bwe bamala okukola ekyo, then they put the baby into 2 rooms. Each room is isolated. Oh my God, it's like a fortress. Omwana aba ali yekka.
You're watching a movie where a kid grew up in a glass. Because
Yeah, and
you remember that movie? I forget the name.
and then she discovers that she's actually not sick.
She was lied to.
And
Yeah.
yes, yeah, I've watched it. So anyway, what happened then is they were put in 2 rooms. Ekyanyamba, when I left Uganda with 2 nurses.
Raising Jayden. Yes, that was the.
Yes. Nali n'abannansi babiri. Each nurse omu ngali ku Nakato, omulala ngali ku babiri, then me. So nga kituyambako, and I made sure bamanyi, because at one point Nakato yali ataninze na blue nga losing her platelets. She had even started clotting nga ebintu ya black bize, but the nurses help a lot. So that's something I also want Jayden to think about. Gwagenda naye bamama balungi okulookinga after, naye mama bw'alaba omwana nga azirika ng'agenda baddukawo ate nga oba weetaaga omuntu abeerewo.
Do you mean to say nti Jayden needs to go with a bedside nurse?
Yes.
Okay.
He either needs a bedside nurse or somebody who is tough on him. So this is what happens with bone marrow transplant.
Zubeda.
So one of the things that happens ate mukwano gwe bwe batandika lwakuba nti it takes long kubanga kati ajja kumalayo 100 days. The first days of the bone marrow is 1 month. Naye the other 100 days baba bamukuuma is what takes long. So
monitoring.
Yes. So the killing of the bone marrow, but fe olwokuba obwana bwaffe bwali butono, chemotherapy bakubira 7 days. Babakuba chemotherapy for 7 days to make sure that a bone marrow efa as in completely. So babafuula normal guli omusaayi gwe nkugambye, then they start on the protocol of the chemotherapy. Bwe bamala okukola ekyo
okozesa oluzungu lungi wano kadamba tajja bitegeera. Kadama bagambye bakuba omusaayi, babawa omusaayi ogumala, then ne batandika okwokya is chemotherapy.
Yes.
Basically.
Yes.
Ne batandika okwokya ziri cells eziri mu busomyo zinembi ne batandika okuzookya kibayambako nti already omwana baba bamuwadde omusaayi nti ne bookya eno alina omusaayi ogumala tugende mu maaso.
Yes, thank you very much. So once that process starts, abaana like day 2 ogenda okulaba ng'enviiri zitandise okuvaako kumanyuka olwakimo. Day 4 nga oba omukute bututu nga butandise okuvaako. Day 5 is when the face becomes black, ba becoming nga badinka, like dark, omwana abadde omweru na becoming omuddugavu. Day 6 ne bayiwa amabwa okuva ku lulimi paka eno wansi ku kabina, like wounds. Day 7 ne bafuna fever. Omanyi fever wa 40 degrees? Gwe bafuna oyo, very high fever. Then ne baddukana. Now the one thing again that I'm going to advise Jayden, bw'olinnya n'ogenda India, genda n'emmere yo. The Indians have grown up on coconut water, simple foods that they've been eating. Ffe baatuwa coconut water nga tezetuyamba. Ekirala ky'olina okujjukira, I don't know about you guys, but our parents buli lwe walwalanga nga bakugamba bw'oba tolidde eddagala terijja kukola. Eddagala likola wali mmere. Ekisingira ddala, now I'll tell you 2 parts where bone marrow patients die. One ku medication ne after the bone marrow. And lwaki bafa wano ku medication? Obulumi buba bungi nnyo. Ate Jayden kati
I have a question.
Yes.
So the falling of the hair is chemo, of course. The blackening of the face, is that also part of the like the effects of chemo?
Yes. Okay. Yes. It is. Now the other thing about Jayden, because he's 23, I would advise him to store his sperms and take them to a sperm donor.
Yes.
Before they do
it affects it affects fertility. It affects
his fertility.
Waliwo emboozi ebadde egenda mu maaso ey'omuyimbi eyazina omusajja w'omuntu n'azaala omwana ate nga bagamba nti omwami wo nti omukyala w'omwami yali takyasobola kumuwa baana. Please note, this woman is a cancer survivor that underwent chemotherapy and all the treatments of the cancer, consequently affecting her
her eggs.
Her fertility, her egg.
Fertility, yes.
We have to keep relating stories or kategede. Yes, in the mass.
Yeah, so I would suggest that he goes, and lately sperm harvesting doesn't cost money. He just goes to one of those, Dr. Sally fertility center is doing it. They harvest them. Namanya nti agenda kudda ngali healthy azala abaana be.
Yes, you know, but harvesting might be free, but storing them, my friend, you need
so here is the business model that they have. They will take them from you, harvest them and store them. It is in the contract, the little dots in the contract where they tell you that for you to utilize them, you'll have to work with this facility.
Yeah, I know.
You get,
like to be
so they'll allow you keep them there, harvest them there, but then he'll tell you when you're doing IVF, you can only do IVF in this, in this hospital. So, I mean, so that's why these 2 processes are free. Anyway, so that was side because of the chemo. Amabwa, so our abana babateekamu akapiira mu nnyindo so that you can deposit food direct to the stomach. Because wano bulago amabwa gaba tegakukkiriza kuyitawo. you also start to change. Your morphology changes a bit because my children looked a bit different from what they were. Abaana ba sickle cell balina engeri gye bafaanana. But once the bone marrow dies off.
Bagambe, morphology is basically your appearance. Not chikula. Like ochuka maybe face nebanga nene. As in your morphology is your body structure.
Yes.
Yes.
Thank you. Thanks for the.
Engeri gye wakula kale.
Yeah. So the other critical parts is that at this point, Baino monitoring a lot. I'll give you a scenario. One of my daughters, Nakato, yali takkiriza platelets. So bwe bamala okukola ebyo byonna, then ne bakugamba ne bakuwa olunaku lw'ozaalibwa. So bamala chemotherapy ebyo byonna ne biggwamu. It's a very hard period. And so for me, the other advice I would give Jayden is to read about it and expect. Me, the way I survived with my children, I would expect, okay, encha tuyinachi, amabaga genda kuja. Okay, ate encha, envaire zonna zigenda kuvaako.
Ate n'ekirala.
Bagenda kukola bwetiti. So that expectation helped us.
One of the reasons why some people don't actually do it is not only money, but it is also like the detail of what they should expect there. And nadala omuntu nga abadde mu bulumi all their lives, they don't want to go through that hell anymore. Nebagamba, you know what? Because it is also pain and death. You know, so bagamba, you know what? I've had enough pain. I don't want to go. Waliwo atusindikidde emitwalo 10 mu kakaaga, waliwo atusindikidde omutwalo, waliwo atusindikidde 5. Yes, tugende maaso mukwano.
So Jayden maybe needs to understand that it's going to be a very painful period during the chemotherapy, but then when you get over it, it's quite easy to get over. Wano kakimo pot kebateeka wano baka cleaninga bakujako. But one of the most important things you have to note is are your infections toina okwata waddugala buli kimu. You have to wear masks. You have to make sure anti buli kimu kyokozesa kiri sterile. You have to make sure anti if you are totambula mukubombu like any other normal person. I heard Jayden earlier saying, nkoze interviews ino nzimaze bwe naakomawo nja kukola endala. I don't know if he knows that he's going to be away for a year, an entire year closed away, isolated. Because when he comes from India after 3 months, bagenda mu isolation ewuwe, up to for another 4, 5, 6 months. Ngaliwe, he does not move. The most he will be moving will be going to the clinic. Okumukolachi, okumuedagala. Yeah. Then akomewo, wakomawo, adda mu nnyumba ne visitors kati fefe kye twakola ka video k'abalongo nga bazanya in their playroom. And what we did was, while they were playing, that's the video we would take downstairs to the visitors. Yes. So wekitaba ekyo Jayden asobola okufuna kubanga ye mukulu, asobola okufuna essimu ne bakuba, and he speaks to them like an intercom sort of thing. Ne bakuba naye nga tebamulinaanye. The highest number of deaths of bone marrow patients has been after the actual bone marrow when you come back home, because our culture allows us to have the caretakers like our mothers, our judges, who believe by touching you, whether she has a small cough, kana kafuba katono kazze nga ndi wali ku boda no tekalina, and yet she's actually infecting you. So that is very, very important. Your utensils have to be. I had to get a room in the house nga mbajja mu bedroom ne mbateeka mu playroom yaabwe. I made sure I equip it
Disinfected.
My God, we would mop that room with disinfectant. We would, it was too much. Ate nga buli omu alina okuba ne masks. The nurses are monitoring.
And gloves and everything.
Yes. One of my daughters got an overdose of her prednisone.
Yeah.
We spent an entire year nga tetumanyi kiki n'afuna low potassium. We had to go back to India. Just by taking more prednisone, bamuwa wrong doses for about 4 days. We went back to India. Ne batukuba eddagala balitajja kavi nga liri expensive. But just because and one of the nurses made a mistake. So it's important that the people looking after that patient,
they are educated.
Yes, bamufako, they don't mess around with medicine. And then
they should be sensitized as well.
Yes, on the foods that they have to eat, Banange, that's very important. Acidic things should be thrown out of the window. Nothing acidic. Abalya pineapples, abasuubira nti obutunda tebulimu acid. You know what? Let me tell you, ekyasinga okuneewuunyisa. Omanyi pomegranate? Enkoma mawanga ne bundiizi. N'amazzi. Those are the three things that will restore anybody who has sickle cell or anybody going for bone marrow. Enkoma mawanga ziproducinga omusaayi zisobola okuya. Neewulira omuntu ng'agwa eddalu ne beetroot, simanyi hibiscus. They don't. It was the first thing they did.
Ebikoola bya avocado.
No, kati ebyo bireeta. Ebikoola bya avocado bireeta. Naye bino bye bagamba mbu olw'okuba bino ebikoola bya red, hibiscus, beetroot.
Wabeeranga waawo some plant nga bakiyita ribena. Waliwo kiplant kya red.
If you have a blood crisis and you're at home, there are two things that you can do. Sweet banana. Buno mbundiizo obutono. Ask somebody akakupiringire okalye. Your blood will start in just a few minutes. Nadala bino after periods katinga fe bakaria.
Nenda ndizi.
Ndizi, yes.
No, ndizo owe Bulaya kuba bannange. I always have low iron.
Yes. No, just do bananas and pomegranate. You will tell me. It will get better. I have a similar problem because of my carrier status.
Yeah.
I lose blood every time I've come out of my period. So I have to either go on a blood supplement, which is a FIFO, whatever the doctor gives me, or I make sure I have banana and pomegranate juice does not leave my fridge. So I do that over the week and I'm fine. The levels of blood will come back up.
I'm gonna buy it.
So that's the story of my twins. It was hard.
How are they old? How old are they now?
Right now they are 8 years old. They just turned 8 on 10th.
And they are perfect. They are healed.
Perfect.
They are healthy.
Naughty. They are perfect, very naughty, very chaotic.
Bannange abantu abatulaba wabeerawo endwadde nga wooba tolina ssente mukwano ofa. Waliwo abuuziza, how did you travel without contamination? That's a
So, this is what we did. Now, for the children, they osabika omwana nawe n'owulira nti tewali kawuka kagenda kumuyitako. We had masks. There's the head obukofira bw'oku mutwe ne mask, then no more egalubindi. The goggles, sea shades, but they're goggles kubanga zo zibikka ne muno mu sides. That's how we went through, because that travel that we experienced was mostly at the airport. Going
Did you
through
have
that.
like a medical pass?
Yes, you do.
A
So
medical
you
pass
have
at
all these
the
letters.
airports.
Yes, so we had all these letters from the hospital saying Zion has just gone through bone marrow transplant. She's very sensitive. Please do allow her in. Now, the beauty about it is we also had first class tickets. So it was easier for us to go through and get ourselves sorted. But security is security. At the end of the day, what if Olimba, they would still check us. So they would check. Then they check the files. We had a hand luggage hand luggage suitcase ngerimu only files only.
Did you have to say how long is it from India to from Uganda to India?
It's about 6 hours. But there's a lot of stopover. No, 9 hours, sorry.
So
Because
I
from
wanted
here
to ask,
Dubai.
did you have to like change the PPE?
What's PPE?
PPE like the protective equipment inti zetuvudde nazo ku nnyonyi eno tuzisuddeyo kati twambadde empya.
Yes, we had to. We had to. Because you have I tell you, no, we twagenda mweno season. It's cold. So winter is not as bad as me when I'm advising bone marrow patients here. I advise them to go during the cold. Obuuka buba bwekute mu ice or whatever.
Gamba ne olaba katenga e Uganda Chibuyaga like dust and everything, like
all that is not there. And the Indians are really, really not very clean people.
They are not.
Oboyagala, it's better for you to go in during the winter. Baba tebaina budde bwonona. So airport, yes. So you go through Dubai and then home. Aweka, of course, bakutawanya tulage, but what we had done is prior, we informed people. Now, I need to talk about something before I go off. Jayden muntu mukulu, omanyi senga, oyinza okukona akagere kowe, akagwe kati nga bwoli, nokona akagere, ne kakuluma nyo, nogama, oh my God, my foot. Naye, your baby, aja kona akagere ako, awogane, mommy, I hit my foot. In 2 minutes, banange ngoma zogamba omwana oyo sorry, aja kukerabira. I don't know if you understand where I'm coming from. Jayden, for abantu abakulu, we register pain, we psychoanalyze pain, we synthesize pain. No jirowooza egenda kujeta, egenda kunumecha, erietya, lwaki enuma. You get kati ebyo bireetedde abaana abakulu abafunye bone marrow okufa. Kubanga they anticipate the pain, they synthesize, bagirowoozaako nnyo kubanga yes biruma. Kati ate it is also different from abafa abato kubanga oli bw'alumwa ng'omuteekako ku bbeere.
Kids don't know pain. So they don't
know. Ku bbeere nga yeerabira. Nze babiri eyafunanga temperature eya 40 n'enkuba mu mazzi n'enki sponge nga n'enkola ki wekimala n'ekituuka n'olaba my baby yali afaanana ng'omudinka nga banange I'm like where did my child go? Naye nga yocha are burning her up nemala nemwrapping and she comes and says bottle and then she drinks, she sleeps. The night we thought that Nakato was going to die nga atandise okukloti nga wano wansi wa nga tubulaba buklotse. She was losing platelets. My baby was in my hands, but she was in so much pain. Naye ng'omukukwatako obukwasi bw'ati. You feel she's in so much pain, you just have to kumuddaabiriza. but omuntu omukulu pain feelinga yetamwa n'okwetamwa. So Jayden has got to go with a very good mindset, very, very good, that kino buli kya experiencing has been experienced by other people, chija kuja, chija kugwa. So he has to know that it's going to come. For example, enviri zigenda kuvako, zigende, zija kuda. Okay? Agenda kuchuka, afuke omuddugavu, chija kulekerawo. So you can understand. So he can even name them and tick them and know that mbita chino chitandise chigenda kugenda, chino chitandise chigenda kugenda. And once he puts that in his head, that there's a solution for every problem he's going to get, I assure you he will go through this process. So I hope I have done the subject justice.
You have done it so well, and thank you so much, Vanange. We thank God that your babies are fine, but you need to, I don't know, we need to, Jayden needed to hear this.
Oh, I'm sure he will. I'm sure he will. And
Jayden,
if I usually
needed to hear this.
I do counseling at my house for parents who are taking children to India. I advise them on what food to take. Kubanga awo wetwala baffe wetwali tuseti kubanga twaffe tukuze tulya protein, tukuze tulya ennyama, tulya ebinyeebwa ebijanjaalo. Kati ate bw'otuuka India ne bakuggyako obutunda bwo bajja bumuggyako then bamuwe 12 packs eza juice. Yes, bajja bimuggyako ebyo byonna. Kati oba olina okujja ffe twatwala ekipooli kya mwana mugimu, the Rutafa ali so healthy even ku muntu omukulu nti ne bw'oli ekinyeebwa kimu eddagala likola. Naye bali baatuwanga coconut water. Kati nze mpa omwana wange coconut water, malemba mukuba ebiddagala byonna ebimuzunza ebimwetoolooza. How is he going to survive? So that was very, very important. Those are some of the things I tell the parents who come home. But I'm available for a console if he wants to talk. I'm here on TikTok, and I'm sure he will be fine. He's a lovely lad, Bambi.
And he's so like full of life and like, you know, like laughs at his pain, you know, but he needs a lot of counseling and information.
Yes.
He does.
I'm available here.
If you don't mind, you could give me your number in my inbox.
Okay.
Of course, other people, bajja kuja abana kwetaaga ababaddeko kuno bajja kuja, but you can give me your number. I'll pass it over to him.
Okay.
And yes, and let people know omuntu, and anyway bagenda kumpa even his number okuteekako his money zetumusondedde, so ajja kukola ki kumanya nti you know, njamuwa enamba mugambe he needs to talk to you.
Then maybe I don't know which hospital he's going to. Waliwo abafere.
They said they said Nairobi. I think a hospital in Nairobi.
I thought he was going to India.
I don't think
Nairobi tagenda kola HLA tests. I think ennaku zino ffe HLA test tuzikolera nawaka, batuweereza bukit from India ne babusanga wano ba parents. Ne babuteekamu eddusu ne basaba $100 ne muziweereza. That is all. So maybe
bagambye tests za Nairobi.
Well, maybe they want to travel, but they can do them here and then they send them to India.
By the way, omuntu omulala gwe mmanyi ali prominent mu Kampala that has sickle cells. Unless I'm mistaken, I think Mariam Ndagire has sickle cells. She even used to do a run for sickle cell. Ndagire Mariam, unless I've forgotten, I remember like Yagamba. alina sickle cell era nga akola nnyo concerts za sickle cells n'endowooza yabivaako.
No, I didn't know that. There are a couple. I mean, to avoid saying, tugamba nti tweyagala, but there's a way for a sickle cell carrier bwe tugenda ne bonding. I don't know. And then you discover
because you feel nobody understands you apart from a person that is living it or that has lived it.
Naye nti oluusi tuba tetumanyi kumanya nti we are sickle cell carriers. There's some magnet that brings us together. Sometimes people are like, so for me, I think the sensitization is to tell young people.
By the way,
you check for HIV,
there is not enough
for
sensitization. There is not enough sensitization on that disease.
So
because it can be avoided even, or chimani.
Exactly, yes. Kubanga mwe testing anga mwakeyagala. And once you do that, you just know.
Is the test expensive?
No, and now it even takes like 5 minutes. You draw your blood, neba kugamba oboli HSS, HB, HS, HSS over SS. Bakugambirawo SS is there.
Kati bannange government ya Uganda, why don't you even make these things for free?
It's so easy. It's so easy.
Omwana ow'obuwala andaba n'omwana ow'obulenzi nga tonnayagala kuzaala mwana wa muntu. Mwe testing mulabe if you don't have the SS and what?
So the normal person has HB or HS. A carrier has HS. Yes, HS. A sickler has
SA and SS.
No, see SA, what is not there, but you have SS. These are sickle cell, like a wholly full-blown sickle cell.
Bannange teri kintu kibi, nga kukeera Katonda n'akugezesa n'ozaala omwana sickler bannange. Ekisooka omwana wo oba tolina ngeri gy'osobola muyamba akagalo kano kayinza omulumaza. I had a friend of mine akagalo kano kayinza okuzimba out of nowhere ne kamuluma n'akaaba akagalo kano. You know, buli kaseera babeera balwadde ate bambi I think because of pain babeera mudde.
Yes.
Babeera mudde baba beekyawa ne beenuubanuuba like bakoowu. Bannange omwana, there is a lecturer awo e Makerere gwe nabadde mbagamba omusajja yazaala abaana 10. Professor abaana 10 nga bonna bafa era nga ye talina obambu mu maka ge nga mwaziika abaana be. Like ngagamba oyo gundi oyo yali first born bwatyo like era nga bw'ojjagamba let me introduce to you my family. Nga akugamba meet gundi abaana 10.
It is deadly. So bambi abantu nga tebaneeyagala, just do the test so that tozaala mwana.
Kumuleeta mu nsi muno kubonyaabona. First of all, the only treatment is what she has explained, and it's hell expensive. It's trauma itself, but that one aside, a lot of people
also, even you as a parent have got to be very resilient. Abantu abasinga babuuza banange, Carol, how did you survive this? How did you, it's very, very hard. It's otuuka
n'okumanya no tebamanya ogenda otuuka omwana wo bamukebedde talina musaayi kyokka talina musujja nga bagamba mayembe nga bagamba bamuloze. Ogamba omwana bamukebera talina kimuluma bagamba talina musaayi bamusindikira amayembe ge gamunywamu omusaayi.
Ate kati ku TikTok kuzeeko abantu bajja ne bagamba oba olina omwana wo wa sickle cell genda onoge kino ekikoola omala kino ennaku 3 and then okomewo otubulira oba alina sickle cell. Naye kati I asked, kati obwo bikola bijja kutta bone marrow, then omuntu n'aterera. So I get very concerned when I see stuff like that.
Content munnange baba batambuza page zaabwe nze ngenda awo ne mbalaba nkwata akawukiwuki okawe omwana akanywe ajja kulekeraawo okusemba mu kibiina bantu bange nga twalya buwukiwuki nga tuli bato nga bagamba no ewonya kansa no ekola bweti no omwana lekeraawo nfuka ku buliri like really ne batambuza abantu ne n'abafollow obasanga nno ne mu comment ngaabuuza how about my son please he does a lot when he's in school he's so dense and you're like really you people bakwata abaana babatwala mu makanisa olaba makanisa bagamba omulwadde wa siriimu tuwonya siriimu TB Joshua you know bantu bange abatulaba mugende mwekebeze before you make a decision to have a child. I know as Ugandans these are things that we don't even pay attention to. You meet a person aina mabina aina six pack aina chibuti ekinene naye aina sente oli aina entumbwe mweru ngogambe ono gwenjagala okuzaalamu abaana bange njagala muzalemu abaana abobuwala babe n'amabina. You want yellow thighs, my dear.
Ate tumanyi okuba abeeru.
A person might not be a sickler, but they carry that trait.
Yes. I have a trait, but I'm very light.
Please go and test yourselves to know your genotype. Bantu bange obulwadde obwo money aside owuliranga muve ku maki muve ku mabina muve ku sente mwekebere anyway abannayuganda no ne bwe tunayogera olaba tebekebeza siriimu olaba tebekebeza kastripo bannange siriimu bamukeberera owenaviira e Kampala bamukebereranga omutwalo ogwa
Mirembe furniture nsambya furniture tulinze contribution zammwe.
Nsambya.
Ate
Millionaire's girlfriend twagala contribution yo.
Yes.
Shida Price twagala contribution yo. Mama Fina tukusaba. Anyway, I know Mama
Boliyenge alina DJ omugagga asinga ebyuma ebyebbeeyi mu Kampala. We're waiting for your contribution.
It ended in tears.
Senga asidi tukyali mu bya sympathy oba twazzeeyo ku nnomo kubanga eno live wano ffe
tukyali ku sympathy ogiro
tutooke tuveeko mu sympathy katono in case nga Jayden takimeekinze abatunda furniture tusuubira mugenda tuwa keesi y'obwereere saagala kumenya mannya mwemanyi mwe abatunda case nyina by the way mbizi jensanze eyo etunda case z'abafu tujigamba what are you going to contribute, what are you going to contribute, I was a money nsema I will see when I sell case asabirira omuntu afe afune case mwezita afune sente zisindikira omuntu omulala mugataasa obulamu. I don't know ba ali confused oba business yajingira agimanyi oba yetaganzo. Anyway, I run it for him muyambieko.
By the way realistically speaking esala y'omuntu atunda cases z'abafu kufuna aba customer.
Tell me, Sengasidi. Realistically speaking. Are you mentally perturbed?
Realistically speaking.
Senga, I'm going to beg to leave you with your partner in crime.
Thank you so much. We appreciate kakati. Konche. That's to so on the day ko.
I will try to kusonda. When I kueleza one, I don't think I'll make any sense. I'm going to try to get in touch with Jayden.
Thank you so much.
Even doing this, but I'll try to get in touch with him.
Actually, Konche, Kansale muko. You need to speak with Jayden or Munyonyole kubanga binne yayogera tabimanya confused.
Mugambye ampe enamba ye njajjiwa Jayden. Yeah.
I'm going to share and I'll try to contribute as much as I can.
Thank you so much.
For him to get. So I mean I could throw in 5,000, 10,000 Kavalala, but I feel my contribution will definitely make a lot more sense.
And also, no matter what day you're sent, already your contribution of that knowledge process procedure India, it's already a huge contribution that is even valuable more than money.
No, I will give him because I know there was a time we were looking for. You'd look for $10, $5 when I need $5. Yes. So anything.
Naye atolabika 30 nayimiridde.
Kakati mukwano.
Wachinyavo.
Mulinayo abaana abalala.
Yes, I have got 4 children.
Oh, and the rest are healthy.
Yes, my eldest is normal. Lidona was Asia. Then my second born has autism, so tetwamuleka kola. Then me
mulaba Katonda ebintu byakola.
Yeah.
So then nze nempa babiri. So those are our children. They're 4. Yeah.
Pero Uganda.
Yes, mbeera Uganda ne walala bwencho.
Badde ngenda kugamba nti abaana baleeta dyewaabwe.
Some friend of mine Bambi.
Uganda is home. So we stay
naye
here.
abaana munnanga abaana olina baleeta bakulira ewaabwe Uganda si waabwe.
Uganda, that's the mission this time.
Bajja kuyiga Oluganda myaka 2 gibamala okuyiga Oluganda n'ekirala mukwano only Buganda. Only in Buganda boogera Oluganda. So Oluganda
nange abantu abambuka akatuuti after now kakutunda 15,000 oba omutwalo plus. Alinda.
Senganze mbadde
kwenjo ne bwotuleka kwenjo ne bwotuleka mukwano, we really appreciate you.
We love you so much. Thank you so much for this informative. Banange, it was really informative. Thank you so much.
Much obliged. Thank you very much.
Bye. Ne bwotuleka kale mukwano.
Alinda. Akatuuti mukwano kakutunda.
Okaguze sente mmeka? Otubandikira.
Wama soka otekeko kubanga tuli kusondera muntu ne bwobanga oyambuse kutuwa information. Sasula 0756 433
akagundi ka pesa ka X ako kakwate ko boti okalaba mukasonda awo
Bulaya abataddeko awo go fund me mu comment ndoza bo kingako egenda kutwala ku go fund miyani ya Jayden.
I wish sure ya Jayden.
I mean GoFundMe is GoFundMe. If you click, you'll see.
Anyway, yeah.
You'll see it's post. And before you send money, confirm the numbers if they are the same numbers. Eziri ku posti ewa Kasuku, ewa Zubeda, ewa Shira Price, ewa abantu abalala.
Kubanga kadame ennaku zino abapere bangi Fifi the Queen ayinza okola.
Sogenda ewa Kasuku oba ewa Zubeda oba ewa Jayden wennyini
Fifi the Queen ayinza oteeka ye namba. Judith Babirye ayinza oteeka ye namba tumumanyi oyo mubbi w'abasajja she might as well okubba ne sente. Kati omuntu nga Fifi the Queen senga asidi. Omuntu nga Fifi the Queen yabbako olede bakadama. How can we be sure? Ntasobola kuteeka we enamba ona hijacking process eno. Kadama beera vigilant. Manange twabagamba social media is not for the weak. Abantu babbira ddala ne muntu atubakozesa.
No. Ekyo kyo bambi kituufu hamu kyayogera.
Yes.
Omuntu akyusamu just enamba eja.
Mu sente ne zigenda empitiri. Ate bwe zigenda ziba zigenze.
Yeah.
It does not cost you anything to verify. Gwe kadama naddala gwe kadama.
waliwo atusindikidde omutwalo ndowooza baye alinda but waliwo atuwadde omutwalo
gwe alinda
aha tokambuwalira bantu bagenda kutuwa ssente
doona waffe fanda alinda
ajja
naye eno as we speak of right now kampu eno erimu sayidi bbiri waliwo abantu abali tiimu
oli wekka
nti pressure gyali n'abalala senga abantu bangi
peji ya pressure ne kabaata mulogo munno
iye
nalabye kabaata ng'aluma n'emba kisajja
ebyana bya sitaani tetwagala kusevinga Jayden mu abaana ba Yesu mu abaagala sirinzeka senga abantu bangi ne Habiba ndowooza owulira senga abantu bangi bali against bannange omuntu omutonzi eyamubumba aba ayagala mubumbulula huwaawi
kakati senga nze mbadde njogerako katono wali wayogedde getting your partners tested we mubeera nga muli mu love nyingi naye ate nga mwerabye nga muli ba sickle cell carrier or something
nga family yammwe erimu history ya sickle cell
obusobozi we bubaawo you do IVF so when you do IVF abaana we bamala okufuuka embryos they take them for genetic testing ne bajjamu abaana sickle cells
nga tebanaba bakuteekamu
nga tebanaba jjukira bwe babajjako enkwaso zammwe omusajja bamugjeeko enkwaso omukyala naye bamugjeeko amagi bafuna embryos nyingi tebeeremu kati ne bazitwala ne bazikebera ennamu ne bazikuteekamu ezina sickle cell
nebazisuula
that is informative to thank you so
kati senga afidi soka olindeko alinda I'm glad senga afidi ogedde bwotyo which means sometimes it's okay to let life go.
Yes, but that IVF is not
good. Banange muleke Jayden agende.
That IVF is not cheap.
Mbabulire abantu abali okunyiga at this point nga munyigira hamu take emotions out of it ona namwe tali serious
nzenga ngoke nyini bwo tugambye endwadde bazireka nezifa ne bazisuula sibe kiri endamu ne bazikola ki ne bazi life support banange if something is worth life supporting do it if it's not let it go.
But that's not life yet
It is. What do you mean? It's not life yet. Life, the moment spam wayingira mugundi. Actually, yesterday never done a video agenda about YouTube. Ngabagamba there is a spark of light. That's life. That's the beginning of life. Senga gwe kanyini ogambye embryos eziri endwadde bazireka nezifa. Ennamu ne bazi implanting amuntu. Which means sometimes it's okay to terminate life because it's not worth it.
No, but sometimes you have to look at the partner. Worth it. It's also worth like 150 million.
We're not talking about diversion, Alinda. We're not talking about partners. We're not talking about wounded. To specifics. Something chinga abortion is saying us. The watching one bana kujira mugundi. Never to test kumwana never gamba. Omwana gogenda okuzala most like agenda kula because of ABC and D. Saying us ngoleko omwana nakula. Ziri good selfish decision nga bali abalemaze bakola ne bazaala omwana.
Actually, nze nefuna olubuto. Nga wakafuna olubuto ne bakola testing ne bagamba nti omwana again aina sickle cell ndujjamu.
Yes.
Ndujjamu.
And there is nothing wrong with that. There is no reason why to omwana
ekimiula bannange kisazeewo kitukyali olwaleero tukirabeko gamba nti ye
bannange live etandise tappinga live bulijjo abeepikira ttone bulijjo abakwana ttone bulijjo abawoza njagala kulya mwanguwe
wama Alinda
Wanjinyabo
olina omusajja
like your information
Yes, I'm looking for how to exit na hivi nemi.
So oli ne watuna bagenda oli no musajja oba tolina.
Nina sebo ham.
Muganda wange.
Oli no mukazi.
Ali no musajja.
Ali no funayo no mukazi.
Tayagala astagfirullah.
Senga kati omusajja bwa mukyayira wanene. Ngategetekete. Omanyi process ekitegeka tufuna olina okubeerawo no stop gap. Olina okubeerawo no mukazi just as backup. Yes.
Tuulira.
Bannaye mwe bikongome mwe bitula or having a boyfriend alone, one boyfriend is not enough. You need to have a girlfriend or other more boyfriends.
No. Realistically speaking, having one boyfriend is you being a risk taker. Kati wafa.
Yes. Beba mubba. Ennaku zino kibaba boyfriend kingi beba mubba. You need the backup. Byetu bagamba wale muwoza tututegeera mukwano. You know what we're talking about.
Soko lindeko. Senga soko gamba watu bagula ebizigo banyirire nganzi.
Baga.
Iye. Tuulira.
Bagula ebizigo bya senga muyirire.
Iye. Babiwulira. Babuulire kwefula mu kubasevinga Jayden. Sente muzigulemu ebizigo. Olabika byolina amagawe nawe olinga luwimizi otambula n'ebivunyu mu face. Olimbu busy contributing ira omuntu already katonda temutegeera bannange bikonkome mmwe senga asidi Jayden bwana aganti agala genda mu bala kuba bala mbakulira bubi I will contribute bwana gamba mbuyeta tanywa mwenge anywe soda agende bujagali anywa amazi
Tanya soda.
Anywa aige kati senga asidi omuntu alina ebizibu bebitu obero tenga tonywa mwenge.
He's even bambi a virgin tazinangako.
Tumufunire mana nange. Senga. Tumufunire tugambe tumufune ekyuma kidemu bama yetekeke embeera afenga azinye.
You right?
Kati omuntu atamalangako what are you trying to save him for? What for? Mutegera bulungi bere mbagamba omuntu atazinanga musevinga wachi akole ekibi means ali useless kunstaina ako mugaso gulyawo. Yes. Senga omuntu ategatta tumuseving. Why are we saving omuntu ategatta nga abegatta webali?
No, abadde bambi scared olwaki
senga olina ebizibu bebiti wegatta
agenda wona bwana
tagenda wona
ate nakasajja bambi kalungi
nedda senga asidi
no olwadde bambi bwe bamufuula
ekisooka already they are developing a fully
kale abannayuganda katuddeyo in the next 10 minutes omutwalo 2,250 emitwalo 10 akakadde bannange oba auctioningeko wano nina ebizigo
nedda senga
bannange auctioninge
wimizi alete ebintu byali atunda tubi auctioning tufunemu sente zigeno tasa Jayden fridge ya wimizi ajebe tuteke auction
my maga
chila price auctioning omusajja wagamba talina mugaso
my beautiful mag
olina omusajja takugasa auction him and save Jayden
banange auction I want to auction my mug like okay not mine but I want to auction a mug like this njikutuseko
queen gwe bagala
wonna woli but oba oli Uganda oba oli mu America oba oli Canada wonna woli I want to auction a mug like this one. Yes.
Louis Mizireta amaze
this exact mug. Mujewano, I want a bidder. Let a person come and bid.
Tona ya kakozesa kizigo kya senga.
Guys, I cannot auction Pluto, please. Enkumi bbiri omulundi gumu tekijja kusoboka tosinika wano binnyo.
Senga Shasha alete kanale auctioning since yagambye life is by the way senga acid since Shasha yagambye life is worthless lwaki tava na contributing omusayi gwe netugumunywamu netuguwa Jayden since yetachagala bulamu
sike $10 Canadian nedda nnyabo
Bannange abantu abagala okwetta
$1 nga 10. Come on guys.